Hello, I am Dr. Vivek Vardhan Virapaneni, a consultant pulmonologist at Shwasa Hospital, Hyderabad. In this video, I'll be talking about respiratory tract infections. Our respiratory tract starts from nose and it ends at lungs. You can get a respiratory tract infection at some point of your time in the life. So it can be a simple upper respiratory tract infection or it can be a lower respiratory tract infection. If it is an upper respiratory tract infection, your symptoms can be something like cold, running nose, you have a sore throat, and you may also have cough. If the infection is lower respiratory tract that affects your lungs, you may also generate some sputum, that is phlegm, that can be from white to colored like yellow or green. Children and elderly, that is children less than 10 years and elderly who are more than 60 are at higher risk of developing these infections. However, anybody can get affected with these respiratory tract infections. Children less than 10 years and elderly people are advised to take vaccine every single year, that is influenza vaccine. And whenever they have symptoms, it's better to consult a doctor before taking treatment by themselves. Even other age groups with risk factors like diabetes, coronary artery disease, that is heart disease or kidney disease, cancers or any other immunosuppressant conditions, it is better to go to a doctor before self-medicating yourselves. However, other young population can use symptomatic treatment most of the cases. However, if it is becoming severe, it is always better to consult a doctor. It is very important to remember that using antibiotics by yourself is not good, because antibiotics can have side effects, and there's a lot of resistance developing in our country to these different antibiotics by the bacteria. So it is always very important not to use antibiotics for viral infections, which most of them are. These infections can be because of a virus or a bacteria or a different organism, but the most common cause is always a virus. Antivirals are useful in some flus, some cases, but not all cases. But antibiotics as such are not really useful to tackle these viral infections. However, if a person develops a secondary bacterial infection upon these viral infections, that is when antibiotics are prescribed by a physician or a pulmonologist. So I advise you all to take all precautions. Wearing mask is always very important. It is not just for the COVID, it is for any other viruses. Mask can prevent many infections, especially the N95 masks. Apart from that, keeping your hands clean and covering your cough are very, very important to prevent these respiratory tract infections. Along with that, staying away from people when you have these particular infections is very important so that you can contain the infection. However, if you go to crowds or mingle with people, they may all catch this infection because it's viral. So this is very important to follow all the basic precautions, and self-medication is okay up to treating your fever or your cold by some antihistamine, but not beyond that, not antibiotics. These infections can be prevented to a certain extent by vaccination. So I advise you to get influenza vaccination or pneumococcal vaccination if possible. And these infections can be dangerous to some patients. Some people may get admitted because of these infections, especially the lower respiratory tract infections. Every year up to 20 to 30% of the admissions in the ICUs are also because of these infections, which usually starts with this simple common cold. So addressing this is very important. So I advise you all to follow all the things recommended and consult a doctor whenever required. Share the video. Thank you.